Hello, my name is Dr. Kelly Foley from Metaprobe Research in London, Canada, and I'm one of the authors on the paper Monotherapy for Toenail Onychomycosis, a systematic review and network meta-analysis. The other authors on this review are either from Metaprobe Research in London, Canada, or affiliated with the Department of Dermatology, School of Medicine at the University of Toronto, Toronto, Canada. So our paper studied onychomycosis and treatments for onychomycosis, which is a fungal infection of the nail caused by dermatophytes, non-dermatophyte molds, and yeasts, and accounts for approximately 50% of all nail disease. To treat toenail infection, systemic, usually oral, and topical treatments are available. Topical treatments tend to have lower success rates than systemic treatments, but systemic treatments may produce side effects and drug interactions. Published studies of clinical trials do not necessarily compare systemic and topical treatments directly. We use network meta-analysis in order to estimate how systemic and topical treatments compare to each other in terms of both mycological cure, so that is eradicating the fungal infection in the nail, as well as in terms of adverse events. So our literature search was conducted as of March 2018, and we included randomized controlled trials. 26 published studies were included in our analysis. We originally wanted to include device-based treatments, for example lasers, as well as combination treatments, but we were unable to do so because randomized controlled trials have not been conducted in these areas. So it's understood that trials show all treatments are better than placebo or vehicle, and our analysis did indeed show this was the case. In addition, results from our analysis show that the odds of achieving mycological cure with daily use of terbinafine 250 milligrams or daily use of itraconazole 200 milligrams were significantly greater than the odds of achieving mycological cure with topical treatments. So the topical treatments we included were cyclopirox 8% lacquer, efinaconazole, and taboberil. Fluconazole, pulse regimens of terbinafine and itraconazole, and the topical treatments did not actually differ significantly in terms of mycological cure. In terms of side effects, there is no difference between systemic and topical medications, and this may be because reports of side effects with systemic medications arose after the clinical studies had already been published. Post-marketing evidence since these trials were published do suggest that there's a risk of adverse events with systemic medication, and this information has been updated in the product inserts for the systemic medications. To conclude, this review and analysis suggests that patients have safe systemic and topical medication options for toenail fungal infection. Clinicians and patients may prefer the trade-off between the decreased efficacy seen with topical treatments in exchange for fewer adverse events. It will be at the clinician's discretion and with patient consultation as to what treatment will best suit a patient's needs. In general, though, efficacy rates for systemic and topical treatments are lower than desired, and there is a need for more effective therapy.